What should I expect during a gastric ulcer endoscopy? Imagine a tiny camera on a flexible tube that can help your doctor see inside your stomach without surgery. That's what happens during a gastric ulcer endoscopy, also called an upper endoscopy or esophagogastroduodenoscopy. It's a safe, common procedure used to find and evaluate ulcers in the stomach lining. First, you will prepare by lying on your side or back on an exam table. Your vital signs, like heart rate and blood pressure, will be monitored throughout. An intravenous line will be placed to give you a sedative, helping you relax and making the procedure more comfortable. You might also get a local anesthetic spray in your throat to numb the area and reduce the gag reflex. Sometimes, a mouthguard is used to protect your teeth and the scope. When it's time to start, your doctor will gently insert the endoscope through your mouth and down your throat. You may feel some pressure or fullness, but it shouldn't be painful. The camera on the endoscope transmits real-time images to a monitor, allowing your doctor to carefully examine your esophagus, stomach, and the first part of your small intestine called the duodenum. To get a clear view, the doctor will gently pump air through the scope to inflate your stomach. This helps lift the lining and makes it easier to spot ulcers, inflammation, bleeding, or other issues. The scope can be moved around to look at all areas, especially where ulcers are most likely to develop. If the doctor finds suspicious spots or ulcers, they might take small tissue samples called biopsies. These samples are sent to a lab to check for infections like Helicobacter pylori or to determine the nature of the ulcer. Sometimes, if bleeding is present, the doctor can perform treatments right then and there, such as injecting medication into the ulcer or cauterizing bleeding vessels to stop the bleeding. The entire process usually lasts between 15 and 60 minutes. Once the examination and any necessary treatments are done, the scope is carefully withdrawn. Afterward, you will be monitored as the sedative wears off. It's common to experience mild sore throat, bloating, or gas from the air used during the procedure, but these symptoms usually go away within a day. Because of the sedation, you will need someone to take you home and should avoid driving or operating machinery for the rest of the day. This procedure is considered the gold standard for diagnosing gastric ulcers because it allows direct visualization of the ulcer's size, location, and severity. It also helps differentiate ulcers from other conditions and guides treatment decisions. If bleeding or other complications are found, immediate intervention can improve outcomes and often prevent the need for surgery. Overall, a gastric ulcer endoscopy is a safe, effective way to understand your condition better. Your healthcare team will explain everything beforehand and answer your questions to help you feel comfortable. Remember, always consult your doctor for personalized advice and treatment options.